Welcome to the session of Safe Childbirth Checklist. In this session, we will learn about the checklist that will help us with safe childbirth. By the end of this session, you will be able to define Safe Childbirth Checklist, describe the layout of Safe Childbirth Checklist in 4 checkpoints, explain how the providers will use this, describe the responsibility of service providers to ensure its effective use, and explain the importance of Safe Childbirth Checklist in improving quality of care for individual women coming in labor. To begin with, let us learn about the checklist concept. Checklist is a tool which enables one to remember to perform all the essential actions one desires to perform in complex situations. Few examples of checklists are Safe Surgical Checklist, Breastfeeding or Family Planning or HIV Counseling Checklist, Safe Childbirth Checklist. So checklist acts as a ready reckoner and job reminder so that providers perform all the essential steps in sequence without missing anything. By doing this, providers will adhere to all essential high impact practices leading to improvement in quality of care. Here in this picture, you can see that pilot of aircraft is looking at the steps of checklist to ensure that everything is ready before taking off the craft. Use of checklists have reduced system failure in complex procedures such as flying multi-engine aircrafts. Similarly, we will see how the use of checklist can simplify process in a complex procedure like childbirth. If we see the continuum of period from conception till postpartum, where do you think we need to focus the most? Yes, this is from onset of labor, delivery till immediate postpartum period, that is within 48 hours after childbirth, when both mother and newborn are at maximum risk and woman is with us in the facility during this period. Most of the interventions happen in the labor rooms. So, we can emphasize that quality of care during childbirth is the key for reduction in maternal and newborn mortality and morbidity. It is very important to know the complexity and challenges of labor process if we want to improve the quality of care during childbirth. Labor has multiple stages. Client may be at different places during different stages. Labor is a lengthy process and there may be change in duty shifts of providers. Multiple actions need to be performed. All actions are to be performed in timely manner. For example, utotonic should be given immediately after birth during third stage. Baby, if not crying spontaneously, should be resuscitated within 1 minute of delivery. Complications can occur at any time and in any case. So, providers should be very vigilant while providing care during childbirth. Some tool which can guide service providers for what activities are to be performed in labor care and when and how to be performed, then their jobs will be easy and they can adhere to those essential best practices. So, the solution to overcome the challenges of labor and to improve the quality of care during childbirth is the Safe Childbirth Checklist. Safe Childbirth Checklist is a tool which focuses on essential practices for safe childbirth. Aim of Safe Childbirth Checklist is to help the service providers to know what essential activities need to be performed, when these essential activities need to be performed, and how to perform these activities. Multiple actions of labor care process are organized around 4 pause points or checks in this Safe Childbirth Checklist. Let us learn more about these pause points or checks. Pause point is a time during the delivery process where the service provider can briefly stop and review the condition of the woman and the newborn baby. Can check whether he or she has performed all the essential activities for safe care and prepare for safe care activities that need to be performed next. These 4 pause points are on admission, just before and during birth or cesarean section, soon after delivery within 1 hour, and at the time of discharge. Check 1 on admission is the first contact of the mother with us. We can pause and review whether we have assessed mother properly, briefed the mother and companion about the process, and are prepared for her delivery in the facility. After initial assessment, if we find that the mother's condition cannot be managed in our facility, then provide initial management, stabilize her, and plan and organize her timely referral to appropriate higher facility. Here is a visual view of check 1 of the Safe Childbirth Checklist. Here you can see on the left side are the activities to be performed on admission, and the prompts for these activities are given on the right side. Check 2, just before and during birth or cesarean, is a point where we can pause and review our preparation for the delivery immediately before delivery, as we might not have time to look for necessary supplies when delivery is happening. Also, at this point, we conduct delivery, active management of third stage of labor, and essential newborn care and newborn resuscitation if baby is not breathing. Here, giving uterotonic within 1 minute after delivery during EMTSL and effective use of golden minute is very important during newborn resuscitation. Here is a visual view of check 2 of the Safe Childbirth Checklist. Check 3 is soon after birth within 1 hour. This period is important for both mother and baby, as the mother is recovering after the delivery and the baby is transitioning from a life in the womb to that in the world. We can pause at this time to review that mother and baby are fine and ensure practices such as breastfeeding and skin-to-skin contact. Here is a visual view of check 3 of the Safe Childbirth Checklist. Check 4 at discharge is the time when mother and baby are leaving from the facility, and hence our constant supervision is crucial. This is an important time to pause and review their condition before discharge and give appropriate follow-up advice. Here is a visual view of check 4 of the Safe Childbirth Checklist. Now let us learn how to use the checklist. Checklist can be used in 2 ways. First way is do and then check, and second way is check and then do. In first way, you are well versed with all the activities at different timings, so perform all the activities as you routinely do. Go through the checklist to check whether you have performed everything and in the correct manner. Tick appropriate responses in the checklist. If you have missed any critical action, perform it and then fill in the checklist. In second way, you can first use the guidance given in the checklist to perform the activities, then perform activities and fill checklist. Medical officers are the in charges of facilities, so their responsibilities in effective and correct use of Safe Childbirth Checklist are to encourage use of checklist for each delivery on the relevant pause point. Encourage correct practices like appropriate use of drugs or antibiotics and proper following of clinical protocols. Motivate the staff for checklist use. Provide hands-on support where needed and solve problems, and streamline the availability of drugs, supplies and consumables wherever required. Nursing staff usually provide services in the labor rooms. So their responsibilities are to keep the essential supplies related to the checklist use ready for each delivery. Follow checklist protocols for each delivery. Record the actions taken for the relevant checks in safe childbirth checklists properly for each delivery, and keep the case sheets including checklists safe for recording of data. At the end, the key messages of this session are that intra and immediate postpartum period is the most risky period for mother and baby. There are 4 checks or pause points in safe childbirth checklist related to the stages of labor, with the key activities to be performed at each point. Safe childbirth checklist helps service providers remember key activities to perform timely and in a standardized way to improve quality of care during childbirth and immediate postpartum period. I would like to inform all of you that a copy of this safe childbirth checklist format is available in your session folder for this session. Thank you.